Hello, everyone. Today, I'd like to talk to you about the common features of maladaptive daydreaming and dissociative identity disorder and how are these two conditions distinct. A large number of very diverse experiences have been termed dissociative, and they range from normal failures in attention to the complete breakdowns in memory and in identity that is characterized by the dissociative disorders. Dissociative identity disorder is associated with overwhelming experiences. They are mostly traumatic and prolonged, overwhelming, inescapable, such as abuse that has occurred in childhood. Dissociative identity disorder, or DID, was previously referred to as multiple personality disorder, as many of you may recall. So what is characteristic, or what features really are typical of dissociative identity disorder? These would be the criteria for diagnosis. So first, we expect the existence of two or more distinct identities. They are also called personality alters or ego states. These distinct identities are accompanied by changes in behavior when they take over, when they take control over the body, as it were. People experience changes in behavior, in style of personality, in their memory, and their way of thinking. These signs and symptoms may or may not be observed by others. Sometimes they are reported by the individual because the identities refrain from appearing or exposing themselves, revealing themselves to others. DID is also characterized by ongoing gaps in memory. These often are associated with changes and switches in identity. So these ongoing gaps would involve everyday events or sometimes personal information, and often information associated with past traumatic events. We call this dissociative amnesia. And of course, so what is expected in all psychiatric conditions, these symptoms cause significant distress or problems in some important area of functioning, such as social life or work or study. These last group of criteria, distress or impairment of functioning, is necessary for any set of symptoms to be classified as a psychological condition, and that would also be true for maladaptive daydreaming. What else can I say about these identities? The personal preference, for example, about food, activities, and clothing of a person with dissociative identity disorder may suddenly shift and then shift back. So the identities happen involuntarily and are mostly unwanted, and their appearance causes a loss of sense of control and therefore creates distress. Some people with dissociative identity disorder feel that they suddenly become observers of their own speech, of their own mind, of their own actions, of their own bodies. They may feel different. For example, feeling like a small child, or like the opposite gender, or huge and very muscular. But these changes are involuntary. That is important to remember. In maladaptive daydreaming, what is dissociated is not the identity or the memory, but actually the consciousness. This is the realm that involves the split. Most people with maladaptive daydreaming are aware of their external environment, at least subliminally, at the time when they are fully immersed in their inner worlds, in their fantasies. By the way, a normal variant of this kind of split of consciousness is the experience of highway hypnosis that many of you may be familiar with. Driving on a familiar route and not remembering anything between getting in your car and being at your destination. That is an example of a normal absorption, intense absorption. While this happens, the driving had still been safe. That is, the individual who has this highway hypnosis and had been completely immersed in a conversation with a boss or with a family member, simultaneously and outside of his or her conscious awareness, were navigating to their destination through the streets, paying attention to the traffic and to the traffic signs. What makes this form of immersive, absorptive daydreaming pathological or maladaptive is, of course, the distress or the impairment of functioning that is often associated with excessive time spent in fantasy, in daydreaming. Both maladaptive daydreaming and DAD involve characters that are part of the mind. In both cases, these experienced entities often feature distinct personality characteristics and physical features and voices, as I've indicated when I talked about DAD. In most maladaptive daydreaming and DAD cases, individuals really understand that the characters are part of the person's mind and are not real people or demons that are possessing them. How are these two conditions different, though? That is something that is important to many of you watching this video. Well, first, trauma is not a necessary condition for the development of maladaptive daydreaming, although it is associated with the development of this condition in many cases. But in most cases, trauma is not involved. Conversely, trauma is almost always part of a person's history in cases of DAD. In DAD, dissociative identity disorder, the identities often comment, react to the person's history or current life circumstances. In maladaptive daydreaming, the storylines can be completely fictional and fantastical. They sometimes can involve real people, but then they are altered into some idealized situations that, in that sense, are completely fantastical and not really and impossible to realize in real life. For example, having an ongoing affair with an office mate that is not at least be interested in you. That would be fictional, although involving a real person. Another point of distinction is the comorbidity, that is the co-occurrence of other disorders with either of these conditions. So DAD is mostly comorbid with post-traumatic stress disorder, obviously, because trauma is a sort of a generating etiological factor there. So PTSD is associated with DAD, often eating disorders and personality disorders, such as borderline personality disorder. That is, of course, to be expected when a child is raised in less than optimal conditions. It's something about the development of personality would be less than ideal. However, maladaptive daydreaming is mostly comorbid with attention deficit and hyperactivity disorder, the inattentive type. That is, of course, also quite logical, because being immersed and focused internally must come at the expense of allocating attention resources to the external demands of reality. Because of the compulsive, repetitive nature of maladaptive daydreaming, we also found that it is associated with obsessive compulsive disorder. In dissociative identity disorder, the identities have a sense of agency. That is, they are have their own control, their own volition, separate from that of the individual, of the patient. So in DID, the identities can operate independently of the main identity's control, while in maladaptive daydreaming, the activation of the fantasy and its characters is volitional and can be stopped at will when necessary. For example, individuals with maladaptive daydreaming often are very conscientious about about not being embarrassed, not being caught daydreaming, because their fantasy often involves movement and mouthing and gesturing. So when there is a risk of somebody coming into the room or somebody knocking at the door, they would be aware of it and immediately stop it at will. Furthermore, in DID, the identities can take control of the behavior and the consciousness of the individual, while this is absolutely not the case in maladaptive daydreaming. This is a very important distinction between these two disorders. Moreover, in DID, patients report the experience of thought interference, that is, thoughts being inserted into their mind or withdrawn from their head. This kind of activity sometimes is present in schizophrenia, but in DID, it is not associated with this mental illness. It's not associated with schizophrenia, but rather with the activity and the interference of other identities. So they would think something, and then there would be interference. The thought process would be interrupted, or some other thoughts would be inserted in their head, but they would come from other identities, that is, from their own mind. What else? Two more points I would like to raise as a distinction between these two conditions, and then I will wrap it up. DID often involves changes in body perception and experience. This is rarely the case in maladaptive daydreaming. Of course, in the fantasy, people can imagine themselves as being different, being perfect, being very beautiful. But that change in perception does not involve their self-image in real life. However, in DID, in real life, patients often report when they experience the shifts and the changes of identities, a concomitant change of their own self-perception. And finally, another very important difference between these two conditions is that DID can involve gaps in memory. That, again, is associated with switching between identities, but this is normally not the case in maladaptive daydreaming. Okay, I hope I have shed some light on these two conditions that are related but different and distinct. And I hope to meet you again when I come out with another video to talk about maladaptive daydreaming and its features. Bye-bye.